Welcome, and thank you everyone for joining us for our virtual conference here today. My name is Chad Wolbers, and I am President and CEO of UnityPoint Health, Dubuque Finley Hospital. COVID-19 has certainly changed the way we do many things, including how we engage with media and the public for announcements such as the one we're going to be making here in a little bit today. While we regret not being able to be together in person for this historic announcement, we are nonetheless very pleased to be with you virtually to be able to share some wonderful news. But before we look forward, I'd like to take a minute to just look back at our heritage a little. The Wendt Regional Cancer Center has been the Tri-State's leader in radiation oncology since 1986. Ever since then, we've worked tirelessly to bring the most advanced cancer care to the people of the Tri-States community. In 2019, this care was recognized by the American College of Radiology, who officially accredited our center following their review of our quality and our safety standards. But beyond being recognized by the ACR for the technical quality of care we've historically provided, we've always provided you with a team of the best caregivers available. Our incredible team is comprised of qualified, experienced, and compassionate professionals who deliver expert-based and heartfelt care for each and every patient that walks through our doors. The announcement we'll be making today builds upon our tradition of excellence, while at the same time marking a new commitment to our patients. And to talk more about that, I'd like to introduce my friend, colleague, and president of Grand River Medical Group, Dr. Ron Iverson. Ron?
Thank you, Chad, and good afternoon, everyone. We appreciate you joining us on this most exciting day. Exciting for Grand River Medical Group, exciting for UnityPoint Finley Hospital, and most importantly, I believe, exciting for the community as we announce our plans to take cancer care in the tri-state area to an unprecedented level. Again, my name is Ron Iverson, and I currently serve as the president of the Grand River Medical Group. And although Grand River by name is a relatively new group, we actually have a long and proud history of providing medical care in the Dubuque community. Formed in 2016, Grand River was a culmination of a merger between Dubuque Pediatrics, Dubuque Family Practice, and Dubuque Internal Medicine. All groups that have been providing primary care and associated subspecialties to the Dubuque area for over 50 years. Over those 50 years, our group of more than 60 providers, along with members of the Tri-State Independent Physician Association, or Tri-State Docs, have a long history of working closely with Finley Hospital, providing physician support or partnerships in areas such as the Kiel Diabetes Center, the Dubuque Endoscopy Center, and the Hospitalist program within Finley Hospital. So today's announcement represents the next step in what we see as a partnership dedicated and committed to improving the health of our community by providing a new and exciting option for patients and their families in need of cancer care. At Grand River, we are very fortunate to have Dr. Mark Hermann, Tony Heyer, and a dedicated oncology staff ready to work with an equally impressive team at Finley Hospital as we make this dream come true. So again, on behalf of the Grand River Medical Group, we are thrilled to be a part of this new venture with the Finley Hospital to improve the lives of those with cancer in the tri-state area. It's now my privilege to introduce to you Dr. Mark Hermann, our oncologist with Grand River Medical Group. Mark.
Thanks, Ron. So I'm very excited to be here. My name's Mark Hermann. I've been in Dubuque now 24 years, initially at Dubuque Internal Medicine, as Dr. Iverson had said. We had a long history here, and now as we evolve, this is an exciting next step in our journey. 15 years ago, I started doing medical oncology here in Dubuque full time. And so as I reflect on this evolution and the new chapter we're about to take, my thoughts are a little bit different, is such that I don't feel we've had to improve upon what we do. The expertise of the physicians, the Wendt Center, the medical community here in Dubuque, whether that's primary care, specialty care, surgical care. We've done and still give excellent care to our patients. What we needed and what we're getting from this merger and cooperation and updated facilities is just better patient comfort, access, privacy, space. It just is going to be a wonderful improvement for our patients that, going through the toughest time in their life, this is just another way to help them with this process. So I'm excited, proud to be part of it, and looking forward to continued cooperation with the community as we move forward. Dr. Lindholm is the radiation oncologist at the Wendt Center. He's going to step up next, give us a few thoughts. But thank you, and excited about the next journey.
Yeah, thanks very much. I'm Paul Lindholm, a radiation oncologist. I'm the relative newcomer here, although my familiarity with this place spans more decades than I care to admit, and 1 millennium, actually. This is kind of the next chapter of my life as well. Excited to have a new collaboration, to have a colleague right down the hall, which is always a wonderful thing for us. Patients benefit, curbside consults, things that can be done on a very, very quick, expeditious basis. Really excited to have the staff here, some of whom I've known for many years. There was a time when I cross-covered the practice for Dr. Tom Lally, longer ago than I care to admit. The technology that we're getting on board, the Variant True Beam Accelerator, which has been in service for a while, is an amazing device. Allows us to use radiation therapy not as a biological treatment tool, which of course is always a mainstay, but as a precise, pinpoint, almost surgical tool for things that are techniques called stereotactic ablative therapy, et cetera, big acronyms, for fancy things. But there are technical aspects of the machine that let us accomplish these treatments much more rapidly to improve patient comfort. But more important than all the technology, again, is the experienced staff, many of them who look at me and say, well, I remember you, Dr. Lindholm, from, and I look at them and say, well, you're not old enough even to remember that time. Of course, Mike sitting right over there is one of those people. So more importantly, than all the technology literally is the staff, the experience and safety with which we can deliver these treatments. So I guess with that said, I'm going to turn things over to Charlie Skemp, if I could.
Thank you, Dr. Lindholm. As board chair of UnityPoint Health Finley Hospital, I'm thrilled to be a part of this historic announcement, and this has been a long time coming. We are all very excited for the days ahead of us. While COVID-19 remains in the limelight, unfortunately, cancer is still all around us. The need for high-quality cancer care right here in the Tri-States is now upon us. Receiving a cancer diagnosis is a life-changing moment. Dr. Hermann said, it's a very fearful time in your life, and having family, loved ones around you, surrounded by a community hospital that treats you like family is something that the board has strived for many, many years. Not having to drive to Rochester, to Madison, to Iowa City is something that's been a high priority for our team. Residents of the tri-state area have received world-class cancer care right here in Dubuque for over 30 years. This is not new to Finley. With the Wendt Center's state-of-the-art technology and experts utilizing the latest treatments and techniques, people do not need to leave this community, and that is a welcome relief for local residents. Healthcare's changing landscape is reflected in the way care is provided to patients, and again, I say treating them as family. Collaboration is defined as the action of working with someone to produce or create something. To me, it means teamwork, passionate care, and the feeling to me of family, treating everyone like their family. Through a new collaboration with Grand River Medical Group, I'm pleased to say we will be creating something that will have an amazing impact on the Dubuque community in the tri-state area. With that, I'd like to introduce Justin Hafer, CEO of Grand River Medical Group. Thank you.
Thank you, Charlie, for that introduction. Thank you, guests, physicians, colleagues, news media, for joining us today. My name is Justin Hafner, and I serve as the CEO for Grand River Medical Group. The future of cancer care will require the collaboration of multiple physicians and nurses that will continue to work hand in hand to make sure our patients are always put first. We're confident that everything we do, from our logo to how we operate, will do just that, put our patients first. Grand River Medical Group and the Wendt Regional Cancer Center are both storied programs in their own right, but together we will be unstoppable. The ability to actively collaborate where both groups are working hand in hand under one roof will raise these two premier facilities into the cornerstone of cancer care in Dubuque. Our new Cancer Center logo will be unveiled by Drs. Hermann and Lindholm. We're excited to welcome the Integrated Cancer Center.
Thank you, Justin, and thank you, doctors. As you've heard just now, UnityPoint Health, Dubuque Wendt Regional Cancer Center, and Grand River Medical Group have been committed to advancing specialized cancer care in the tri-states for many, many decades. Now, by working together in the Integrated Cancer Center, we will further enhance the overall care provided to our patients by combining these two storied traditions of excellence. By partnering together in one location, we believe we will absolutely be, as the old saying goes, better together. And when we say that, we're not just talking about the two traditional modalities of radiation and chemotherapy, but for a whole host or bouquet of services, which includes multidisciplinary clinical care team planning, genetic counseling, cancer-based PT, support groups, nurse navigation, and many other care services that serve to support your clinical care and personal experience needs. Of course, we hope you never have to see us, but should you need us, know that we are here for you. Some of you already know this, as you've allowed us to care for you and your families for the past 36 years. If you or a loved one has received care from us in the past, you know just how incredibly capable and compassionate our staff is. We hope you continue to entrust us with your care and ask for us by name. And when you do, know that Finley Hospital and Grand River will stand together at the ready and alongside of you to help you face what may be the most difficult battle of your life. That's what we're here for, and that's what we do. Together, we have a long-standing legacy of leading cancer care yesterday, today, and tomorrow. Thank you for allowing us the privilege and the honor to continue that journey with you, our community, and for sharing in our good news here today. Thank you.